Hello, my name is Joe Westwood. I'm a student at the University of New England studying sports and exercise psychology, and today I would like to discuss arousal, stress and anxiety in sports. So arousal, stress and anxiety in sports are pretty important areas of both sports psychology and sports performance, as evidence suggests that pressures such as anxieties and stresses and arousal levels have a direct correlation to peak performance in relation to an athlete. Pretty important stuff for both the athlete and the coach. So what is arousal? Arousal is a mixture of both physiological and psychological activity one is experiencing. It's the awakeness or level of activation you may experience throughout a day, ranging from deep sleep or like a coma-like state to intense jubilation or excitement or even despair, as arousal is not just positive or negative. And what is anxiety? Anxiety is a negative emotional state characterized by nervousness, worry and apprehension, and is associated with physical activation or arousal. It is also related to one's inability to cope with environmental stress. Now, stress is more of a process than an experience, and it comes from not being able to cope with a problem that arises or is presented to us. The processes will present themselves in stages, stage 1 being environmental demand. This is a demand which may affect someone or cause doubt or negativity, and in the context of sports it may be standing on the last tee with a one-shot lead, and, the pressures of having to do well in that situation, or being asked to take the last penalty kick in a game of football, with your kick deciding whether your team wins or loses. Or the pressure mounted on an athlete from the media or fans. This can also be an environmental stressor. Individuals' perception of the environmental demand is stage 2. Different people respond differently to the demand presented to them in different ways. Some people will relish the occasion. In sports, these are known as big game players, while others will be overcome by the occasion and not be able to perform to their normal performance level. Stage 3 is the stress response. Depending on an individual's response during stage 2, a person may experience state anxiety, which I'll come back to in a moment, muscle tension changes in arousal levels, narrowing of focus, and other immediate responses to the stresses. And in stage 4, behavioural consequences may be found. Based on the previous 3 stages, this will determine the outcome of what happens next in terms of the person's performance. An athlete may experience physical consequences such as tightening of the muscles, causing, for an example, a runner to jump the blocks early or a rugby player to shank a last-minute penalty. So back to anxiety. People can have varying levels of tendency to be anxious as part of their personality. This is known as trait anxiety. Trait anxiety is a disposition within a person to interpret non-threatening events as threatening, thus resulting in a disproportionately high state anxiety response. Highly trait anxious people usually experience more state anxiety, and people who are generally chilled out or laid back may be low trait anxious people, and highly strung people may be highly trait anxious people. So what is state anxiety? Well, it's more of a moment-to-moment anxiety, characterized by feelings of nervousness, worry, apprehension, and things like a job interview or an exam or performing in front of an audience or under evaluation can fill one's mind with these sorts of negative thoughts. This is a type of state anxiety known as cognitive anxiety, a reactionary response to moment-to-moment changes in worries and negative thoughts. The other way in which anxiety can manifest itself is through physical symptoms, such as increased heart rate, sweaty palms, shortness of breath. This is known as somatic anxiety. And based on the beginning level of one's trait anxiety and the introduction of state anxieties due to external and internal stresses, the performance of an athlete can be greatly affected. The significance of these factors in relation to sports psychology is to try to understand the relationships between arousal and anxiety performance, as an understanding as to how these are connected is vital to helping an athlete achieve peak performance. The main theories that best describe these relationships that have been developed started out with drive theory. This theory suggests a linear relationship between arousal and performance meaning that the greater the level of arousal, the greater the level of performance. This theory is nowadays seen as perhaps a little too simplistic, however it did set a precedence for the lines of thinking that were to follow. Next was the inverted U hypothesis. This theory follows a similar logic to drive theory, however follows a curved line rather than a linear line. This means that increased arousal can improve performance, but only to a certain point, which is when the athlete reaches peak performance, after which further increased arousal may decrease performance. This theory is good, but more information is still needed to better understand the relationships. Catastrophe theory is a theory that suggests that during a sports activity involving low cognitive anxiety or a low stress activity, like a social game of tennis with a friend perhaps, performance will increase and decrease much the same as the inverted U hypothesis. However, when the athlete experiences higher cognitive levels of anxiety due to stresses, the performance level will increase to an optimal level. However, if the arousal increases after that, the performance level will drop off dramatically. This is the catastrophe. Following this, Graham Jones and his colleagues developed anxiety direction and intensity. They attempted to investigate whether an individual's interpretation of anxiety had a bearing on its relationship to their performance. What they discovered was that individuals can view anxiety symptoms as either helpful, being facilitative, or harmful, being debilitative, towards their performance. This is dependent on how much control the individual feels they have over the state anxieties. Things like goal attainment and developing the ability to cope. Through things like goal attainment and developing the ability to cope, one can view the anxiety as facilitative and improve their own performance. These key theories, along with others, help sports psychologists understand and monitor the relationship between anxiety, arousal, and performance, allowing them to implement strategies such as goal attainment, breathing exercises, and many more to better manage the issues that present themselves to athletes and improving performance. Thank you.